Well, good morning, everybody. Welcome to Iowa Ideas in the session on in-home caregiving accountability. I've got a great group of people to talk about this topic with you this morning. I'm just really happy that you're here. My name is John Hale. I am the co-owner of the Hale Group, which is an Ankeny-based advocacy and communications firm that focuses on aging Iowans, Iowans with disabilities, and the caregivers who support them. It's my privilege to moderate this session today, and I'd like to read to you what the Gazette, or how the Gazette explains or describes this session. They say this: as life transitions us to rely on others to complete daily tasks, remain safe, and prioritize healthy living, the role of the caregiver becomes critical. From family members to professional staff, what structures and guidelines will ensure the best quality of care and quality of life? When and how does a pattern of misconduct warrant action, and who upholds the consequences? That's the Gazette's description of this particular session. A really important one. A lot of fundamental issues there that are being raised just in that intro. Before getting into the meat of the topic, I want to take this opportunity to thank the sponsor for this session, which is the University of Iowa Healthcare, and ask you to briefly watch this brief message from them.
Hello, I'm Suresh Gunasekaran, CEO of the University of Iowa Hospitals and Clinics. We are delighted to be part of the Iowa Ideas Conference. Iowa Ideas provides a unique opportunity to bring together a wide variety of different voices, perspectives, and thoughts to create a better future for us all. Challenges in recent years have accelerated how we think about and deliver healthcare. For example, we have seen a move towards telehealth, but we need to be careful in how we analyze that trend as UI Healthcare performs tertiary care, which is still largely inpatient. So we need to think long and hard about what these trends of healthcare mean. It has also highlighted serious gaps some Iowans face in receiving adequate healthcare services. As an industry, we are constantly innovating how we perform healthcare with the use of new procedures, innovative technologies, and new ideas. Let us start the discussions here and follow through to deliver better health for all. Thank you for being a part of this important discussion.
Well, once again, thanks to the University of Iowa, thanks to the Gazette. Let's dig into this. Again, today's session is about what I view as a significant aspect of healthcare services that rarely gets discussed in any public forum, in the media, or at the Iowa Capitol. It's about care that's provided in the home, before or after a hospitalization, an illness, or the loss of independence that comes along with aging or having a disability. Healthcare happens in the home. Quality of life is determined by those who assist in the home. And I would dare to say that the healthcare system would collapse if it were not for all of the work that's done in the home to support Iowans who need help. So thanks to the Gazette for elevating this topic and allowing this panel to discuss it. With me this morning is an exceptional group of people who bring unique perspectives to this topic. I'll now turn to them briefly to have them tell you who they are and what they do. And let's start with Joe Kline.
Good morning, and thank you, John. And I'm so pleased to be a part of this. I am an attorney, but mostly I am a researcher, writer, and speaker on the topics of healthcare demographics. So that's both nationally, and now I'm focusing on Iowa, but the perfect storm that is approaching, which is our aging and healthcare demographics, along with the loss of our healthcare resources.
Thanks, Joe. And we're going to get to those demographics as this session unfolds because it is a key driver of everything we talk about. Next, the lovely and talented Diana Findley.
Thank you, John, and good morning, everyone. I am the Executive Director of Iowa Caregivers, and we are an advocacy group, nonprofit advocacy group for direct care workers and the thousands of Iowans who rely on them. Have about 30 years in that space. I'm happy to be here. Thank you.
Thanks, Di. And last but certainly not least, we're really pleased to have a representative of the Iowa Department on Aging this morning, Eugenia Kendall. Eugenia, tell us a little bit about yourself.
Sure. Good morning, everyone. Yes, I'm Eugenia Kendall, and I just recently joined the Iowa Department on Aging. I previously worked at a Heritage Area Agency on Aging for about 7 years. So I'm now the Director of Services to Promote Independence at IDA, and I'm happy to be here. Thank you.
Okay, let's start with a kind of a quick reaction question, get a reaction from each of you on this. What kind of shape is the home care system in? Is it giving Iowans what they want? And is it giving Iowans what they need? In other words, is this in great shape? We really don't have much to talk about. Is it doing okay? Or do we have some serious challenges in this arena? Di, let's start with you.
Well, I mean, there are so many aspects of it, but I think from our perspective, what we're hearing from home care providers and from people with disabilities and older Iowans and family caregivers is the workforce challenges that are compromising people's access to care and support.
And by compromising, Di, are we talking about a little bit of compromising, but a whole bunch of compromising?
Well, I think if you look at the far-reaching impact of it all, I mean, the bottom line is if you don't have workers on the front line, you don't have access to care. And that can be pretty devastating for family caregivers, especially those working family caregivers who may, they may have to give up their gainful employment or cut back hours. And then that in turn has a huge impact on the business community and our economy overall.
Thanks for that, Di, and we'll pick up on what you just mentioned there in just a bit. Eugenia, how about you for a quick reaction in terms of the health of the home health business?
Sure, John. Thank you. So the Iowa Department on Aging, passes funds right down to the area agencies on aging to be able to support the network and services in their local areas. And what we're finding or hearing is that there just aren't enough providers in some of our rural counties. So they're actually creating positions right in the area agencies on aging to have like this rapid response, to some of these in-home care needs. But it's certainly difficult to, provide those services when they don't exist.
Thanks, Eugenia, and let's go to Joe for a quick reaction.
I think I come most from the healthcare consumers perspective, and I would say that would be a huge unmet need from anyone that I talk to. But I want to say too, I think we're just now beginning to see the tabulations and really feel the damages. We would be having even a different conversation 20 months ago. The pandemic and the effects of COVID have ratcheted up everything. It's put it all on steroids. It's sped it up and it's increased it. So it really is a conversation that needs to happen now.
Well, you've each talked about things that we're going to dig into a little bit deeper here. So thanks for those quick reactions. To give our audience some context here, who provides all of these services in the home? How much of this is provided by paid employees? How much of this is provided by, in an informal way, by families and friends? Do we have a good handle on this? I know we've indicated that we've got significant, everyone's mentioned this, we have significant workforce shortages, but then we also have a workforce that's not paid, but it is huge in terms of the number of people who are helping family members or friends or neighbors or whomever to live the best life they possibly can. What do we know about this arena? Eugenia, let's start with you.
Sure, thank you. Well, from our wonderful community partner, I see Anthony on the phone here, or on the call here. AARP helps us understand more about like how we can estimate. So what we know or can estimate is about 317,000 Iowans provide informal care to either their parents, their spouse, or another adult. And that's pretty huge because they actually provide lots of their own out-of-pocket money. So, and I'm sorry, I just lost that figure here that I had, and I'm sure Joe or Di might have that in front of them as well.
Because I got it from you, Eugenia.
I know,
So
no,
thank you.
Find it.
Yeah, it's 317,000. So yeah, and 3.8 billion in unpaid care. So yes, you gave that to me. So go ahead.
Yeah. Well, and 38% of households have one or more persons with an adult 60 or over. So it is a significant issue. They provide the majority of the care, you know, but and certainly help support that whole system with direct care workers as well, because they provide the more skilled care that maybe our in-home informal supports can't do.
And Eugenia, just to put an exclamation point on what you've said and to make sure that I and the audience understands this, when we talk about 317,000 people, we are talking about 317,000 people that are helping to care for and support adults. We're not talking about childcare here.
Right.
That's
Correct.
a whole different deal.
No, exactly. You know, 1 in 5, they estimate, is a caregiver, you know, of their spouse, of their parent, of their, you know, loved one or neighbor, family friend. You know, 61% of these folks are employed while providing 24 hours of unpaid care each week. And they're hugely in need of emotional support. They're under financial stress. And 25% indicated that they have difficulty coordinating care. And that was all taken from, you know, the Caregiving in the US 2020 report from AARP.
Well, those numbers are huge. Those numbers have immense significance to not just those 370,000 people who are involved in this, but as you indicated, I think 60% of those 317,000 people are employed beyond doing their informal caregiving challenges. So you can see the impact this has on those individuals, but also the impact that it has on those employers. Really some big and some important numbers. Di, help us understand a little bit about the paid side of this. Who are the people that do this work, and help us understand the distinction between home care, what we call home care, and what we call home health care.
Sometimes that depends on who you ask, but I guess I would give an example of our public health entities, for example, our local public health providers. They are, that would be an example of a certified home health agency. And they employ home health aides. And in order to be certified, they have to comply with certain standards of federal requirements through the Centers for Medicare and Medicaid Services. So their home health aides do have to have a certain, you know, amount of training and so forth. And again, it's my understanding that there is some oversight by the state for those certified providers. But there are also a lot of other home care, home companion kinds of services, non-medical services that also provide in-home care. And the titles for these people who work in these jobs range from universal worker to personal care assistant, home health aide, home care aide. So it's a little bit fragmented, and sometimes that's because of, you know, the particular payment system. It's a little bit fragmented and hard to follow.
So I know that this is a little bit fuzzy and it's going to remain fuzzy, but is it fair to say that when we talk about home health, we're talking about people who are going into people's homes to assist them with health related things, medical related things? Maybe it's a medication issue. Maybe it's somebody that has an IV. Maybe it's somebody that has whatever that needs some medical attention. Those folks are providing home health. Then on the home care side, we have lots and lots and lots of people who are going into people's homes, just helping them do stuff during the day. It's not medical stuff, but it's maybe helping them, if it's a person with a disability or an older person, helping them get up in the morning, helping them get dressed, helping them get ready for the day. Maybe it's making breakfast, maybe it's being there for lunch, maybe it's all kinds of things that we all experience and we take for granted that we're doing every day. But there are lots and lots and lots of folks who need help with those basic day-to-day activities. So is that a good distinction between the two?
I think that's good and right. It's those activities of daily living, that really help people remain independent and in their own homes for as long as they can.
Di, do we have any idea of how many people are employed doing this work? Eugenia gave us the number of 317,000 Iowans who are doing this informally, not being paid for it. Do we have any idea how many folks are out there who are doing this to make a living, who are being paid for it?
Yeah, in our work with Iowa Workforce Development, their statistics are around 40 to 45,000 in these direct care jobs. Three occupations that are recognized by the Bureau of Labor Statistics: certified nursing assistants, home health aides, and personal care assistants. And but in conversations that we've had with them, and we contracted with them in 2019 to do a wage and benefits survey of direct care workers, we did come to the conclusion that that might not include everybody who's working in this field. So we came up together with the estimation of between 45 and 60,000 who work in the field in all settings, not just home care, but nursing homes, hospitals, yeah.
So we don't have a good, fixed, reliable number that just tells us, here are how many people out there in Iowa providing services to people in their homes. We just really don't know that. Okay. And so just one additional question, Di, before jumping to Joe. I know that there's a registry of employees who are certified nurse aides who assist people in nursing facilities. And there's a reason to have that registry. Is there anything like that on the home care side? And if not, should there be?
Well, thank you for asking that question, John, because this is something that we've been working on for more than a decade. And I see Anthony Carroll on here and Larry and a few others who have been partners in this effort to expand the Iowa Nurse Aid Registry, which requires only CNAs who work in nursing homes to be on it. And I don't have time today to get into the weeds on this, but I will say that one of the components of this legislation that we proposed is a voluntary, well, it would include home health aides and all these other direct care workers. That's one thing, by expanding the direct care worker registry or the nurse aid registry. But the other component of it that family caregivers and consumers might be interested in is this voluntary public portal of caregivers, which could maybe broaden the pool. So what we've envisioned is that those who are on this expanded direct care worker registry could opt in to this public portal and become accessible to pick up and help fill some of the gaps that are out there for family caregivers, other employers, and consumers, people with disabilities. And it could also become a way to attract some older workers who maybe they can't do the physical work anymore, but they could do, they could do something less physical and fill a need. College students and others. So it could broaden the pool of people to help with this horrible workforce shortage that everyone's experiencing right now.
So Di, I know that this gets kind of technical when we're talking about registries and all of these things, but as it relates to the lives of real Iowans, let me throw out an example here to see if I understand this and I'm on the right wavelength. If I have let's say I have a child with a disability, or I have a mom or a dad or a spouse or whomever that needs some help on an ongoing basis. And I, rather than wanting to go through a service provider who employs a lot of these folks, let's say I just want to hire somebody directly that I know who does this work, that is in the same geographic area that I am. And I want to find somebody that's good, that's got some experience, that has some recommendations. Is there any way for me currently to easily do that? Is there some place I can go to say, okay, there are 40 people here in Fort Dodge that are available to assist me and my family? Is that possible, or is this much more difficult than that, to just hire somebody directly?
Not that I'm aware of, John, and if there was, we probably wouldn't be proposing this voluntary public portal of caregivers. And I think the other thing that a system like that could provide is a certain level of public safety. I mean, the devil's in the details. There would be a lot to be worked out, liability issues. I mean, all kinds of things. But I do think it could serve a really valuable resource for some of these people who are desperate to find help.
Great point, Di. I mean, if I, as a consumer, want to hire somebody, I want to know what their qualifications are, and I want to know that they've got some recommendations. But I also, most importantly, want to know, can I trust this person?
Right.
They're going to be coming into my home, or they're going to be coming into my mom or my sister's home. And can I be comfortable that they are going to provide them with good care, but they're also going to make sure that they're safe? So, great point. Joe, I want to turn to you briefly. You're the demographer in the group. You know the numbers, and it is critically important to understand the trend lines here. So help us understand how the demand for home care services is going to continue to grow. And let's focus on Iowa, but it may be the case. Sure. Same answer for every state in the union.
And we're similar but worse in some senses than the whole nation. The big number people look at a lot, and the one that's most startling maybe is the 135,000 additional Iowans who will be 65 and older by 2030. So that would be like cloning Cedar Rapids and filling it with seniors. And those are 135,000 more than we have today. So that's the growth in that cohort between now and 2030. Yes.
Joe, could I interrupt you there just to have you repeat that, because those numbers are so significant. I want to make sure that we all got.
Yes, 135,000. So more 65 and older than live in Iowa today will be here in 2030, 8 years from now.
Okay.
So it's a huge number. It's a huge number. For purposes of this discussion, which is so vital to one piece of healthcare, let's look at a ratio that's called the caregiver support ratio. And that really drills down on people who are 80 and older. And again, this is not even really taking into consideration our children who need caregiving, but 80 and older. And then we look at the group who is most likely to provide those services, which is going to be age 45 to 64. So paid and unpaid. Okay, so we're going to look at just those two numbers between now and 2030. We're going to grow the number of 80 pluses by 45,000. Okay, so another 45,000 of people in Iowa will be 80 years and older than are today. That's a burden, but it becomes an unreal burden when you find out that we're losing 43,000 out of the group of potential caregivers. So as the group 80 plus grows by 45,000, the group that's 45 to 64 dwindles by 43,000. So it's a double whammy. It's more people to take care of and fewer people to care for them as both paid and unpaid. But it is our pool of potential caregivers.
Joe, those numbers are both startling and concerning. The thing that came to my mind as I was listening to that was, and maybe this is an inappropriate way to refer to it, but it sounds to me like we've got the potential for a train wreck here.
Yes, many people refer to 2030 as the wall, when a train literally hits the wall, because that is the year that the youngest boomers turn 65. And we've always viewed 2030 as the wall because we thought, okay, this is when the supply and demand is going to be most vivid. In healthcare and lots of things in this country, but we're focusing on healthcare. But that was called the wall. But it is a train running into a wall that we are totally not preparing for at all, that I can see. So this conversation today is more than vital.
Well, I think you've just hit the critical point, Joe. I mean, the data tells us, I think we've already set the stage here saying we've already got a system that isn't working the way it should, doing all that we would like it to, in part because we don't have the number of providers, as Eugenia has said. We don't have the number of workers, as Di has said. So we've already got a problem. But when you look at the demographics for Iowa and what we're going to see over the next decade, we're going to have more and more people who are going to be needing help and fewer people to provide it. That's not the kind of recipe we want to have. And just so people will know and have, again, some context for this, one of the most significant pieces of data that I've heard talked about in this arena over the years is that 7 of 10 of us over the age of 65, and I unfortunately have to throw myself in that category, 7 of 10 of us can anticipate that when we're 65 and over, until we die, we are going to need some kind of help to allow us to make it through the day and live our life the way we would like to. Now, most of us just want to assume that, hell, I'm never going to have that problem. I'm going to be one of the 3 of the 10 whose lives are going to be perfectly fine. But 7 of 10 of us, 70%, are going to need someone to help us. So I think those numbers just reinforce the importance of this topic, why we're here, and let's just dig a little bit deeper into some of the things we've talked about.
John,
Yes, Di.
could I just say the other layer here is I don't think we are yet to realize the impact of COVID on this workforce, because people have been bailing, since the beginning of the pandemic for a variety of reasons, pre-existing conditions, being afraid that they're going to infect their loved ones who may be at risk, or child with asthma or something. And so I think, it may be a few years before we really realize the impact of COVID on this workforce and our ability to recruit and retain on what is already, as Joe pointed out, a very serious challenge.
Well, I want to mention a statistic I found in Iowa that I was so saddening to me. Iowa, we had great growth in our healthcare workforce, our overall healthcare workforce from 2011 to 2020. We grew up by 12,000 workers. I mean, we worked hard to do that in Iowa. In the last 12 months, we have lost 35% of that growth. In 1 year, we lost 35% of a decade's growth.
Well, I think it's really important, Di, for adding that layer onto this conversation, and that COVID, as Joe has indicated, because obviously we all know, we've all been impacted by this in some way or another. If we've had any needs for healthcare, whether it's home care, whether it's we've got a relative in an assisted living facility or nursing home, or we've been hospitalized, or a friend of ours has been hospitalized, we've all seen and experienced the tremendous impact of this and the negative impact of this. So that variable of COVID is huge. Let's dig into just a little bit more about this workforce challenge, Di, and I know you've been in this arena for a long time, and help us understand why in the home care world we have this fundamental challenge of being able to recruit the number of people that we need to have and to retain the number of people once we've got them recruited. What's the fundamental problem here?
Well, as you all know, I mean, this is a workforce that was in crisis long before COVID, but as Joe said earlier, it's just, you know, really exacerbated or brought more attention to just how essential this workforce is. But wages is huge, obviously. We contracted with Iowa Workforce Development in 2019 to do a direct care worker wage and benefits survey, which is a bit of a departure from what they usually do when they survey the employers. And it gives you a little different, you know, perspective when you hear it directly from the people, you know, who are working in this field. So at that time, the median hourly wage was $13.80, and about 10% had no health care coverage from any source. So again, I mean, it just seems it's such a travesty, you know, and a sad commentary on our society to think that we've got people out here in the midst of a pandemic, 10% of them don't have healthcare coverage from any source. Affordable child care, I mean, all of these are challenges for people who are not earning a wage that is consistent with the importance of the work that they perform. And we have been in conversations with Workforce Development, and it would be great to see them repeat that survey to see if in fact wages have gotten better because of the supply demand issues since the pandemic. And even if it is, I suspect that it's not going to be high enough for providers to be able to compete with the retail, manufacturing, you know, restaurant and other sectors who are also struggling to find workers and have raised their minimum wage to somewhere between $18 and $20 an hour. So,
Di, you indicated that $13.80 is the median wage. Do you know what the starting wage is for somebody that's just going out and starting in the home care world?
no, I can remember the lowest, I don't, not just off the top of my head. I think the lowest hourly wage from that survey was $9 and something, so.
And again, I think we need to remember what we're asking these people to do. We're asking people that work in home care to go into someone's home that they may not know, in a neighborhood they may not be familiar with, and go in and help them with some very personal things, difficult work, challenging work. It's not like, I mean, contrast this with working in a nursing facility, for example, where you as an employee are one of many employees. You've got a lot of other employees around. You've got supervisors around. And if something difficult crops up, if there's an emergency, you've got other people to rely on. In the home care world, you're going into somebody's home and you're it. You're responsible for everything that goes on there, all the needs that a person has that you may not necessarily have been trained extremely well for, but there's a huge amount of responsibility there. So to not be paid well for what you're doing, and to be in today's world, to be able to go out and find a job in retail or fast food or whatever, that's going to pay you significantly more, and layer on the issue of COVID, where you're going into someone's home and you have no idea whether they've been vaccinated, whether they've come in touch with people, whether this is an issue. There's going to be a little bit of a challenge here, to a mental hoop to jump through, that say, boy, I really want to do that right now in this world of COVID. So point well taken. Di, one more question for you about this workforce. Do we have any idea what the amount of turnover is in the home care world? Because so much of this is relationship based. If you're a person living alone in a home and you need services every day, I would think the one thing that's critically important to you is you want to know the person that's walking through the door. You want to have a relationship with them. You want to be confident of them. You just want to trust them. You can't do that if you've got a new person coming in every other day or whatever. How big of an issue is turnover in this arena?
Well, again, I don't know that we have any records at the state level, like nursing homes. They submit on their cost reports to the Department of Human Services what their turnover, their staff turnover is by worker classification. And so I think the last report was around 64% annual turnover of CNAs.
64% annual.
But and I suspect that's quite a bit higher the past couple of years, but also high turnover of nurses and administrators and others who work in those settings. But in home care, I'm not aware that we have that data. I do hear from family caregivers the frustration that they experience, like if they have a loved one who has dementia, and consistency in care is really, really important. I had one individual tell me that they had, it was some astronomical number, like 50 different home health aides in a year's time. It was just a constant churning of people. And yet I see, and I mean, we work closely with some of the public health entities across the state, and they seem to have people who, I mean, they don't seem to have the turnover that others do. And I don't know why that is, but we have noticed that in working with them. But to answer your question, short story long, not that I'm aware of.
Well, and that's been my understanding as well, that we just don't know. We've got no data, nobody's tracking this, yeah. But I think we all know anecdotally, any one of us who had a personal relationship with this issue, we have friends, we have family members who have loved ones, a person with a disability that's being assisted in their home. We've all heard the same story. The same person just doesn't show up all the time. We can't depend on this same person to be there. And your point about up to 50 different home care aides in a year's time helping a loved one, I would think that all of us, and I would think that all of the audience would hear that number and think about it and process it in a very personal way and think about, okay, this is a loved one of mine. That's just not acceptable. It's just not acceptable. It's not what anyone would want. You want to have a good person that you know, that you trust, that you respect, coming in to help that loved one. And if you don't know who's going to walk in the door on any particular day, that is very, very, very concerning. So thanks a lot for those comments. I want to jump to a different topic, related certainly, and that is, and as the part of the predicate of the Gazette's definition of what this session is all about, they ask about accountability and oversight. And this world of home care is a mixed bag, because Di, you had talked about the home health agencies that are certified by Medicare and Medicaid. But then we have this huge number, a number that we don't know, other than we just know it's a whole bunch of private providers who are providing home care services to people across the state. But no one is, we don't even know how many we've got. We don't know where they are. We don't know what kind of service they're providing to people. There's no complaint process that exists for people who have not been well served. What's going on in this arena? And compare that, any one of you feel free to jump in here, compare what we've got with the nursing home world in terms of accountability and a complaint process that exists for people who are concerned about the care of the loved ones getting in a nursing facility versus home care. Paint that picture for us. What's the contrast here? What do we have versus what do we need to have? Anybody?
I guess I'm going to speak from that consumer's viewpoint again, that I'm not really on board with what we have for nursing homes, so I would hope we wouldn't use that as a model. We just simply don't make these things a priority. They're not a fiscal priority. They're not an administrative priority. I think through COVID, what happened in our aging population is horrifying. And a lot of that was simply because they did not have the resources, and they didn't have the private resources, but as importantly, we didn't have the governance resources to stop what happened. The Ombudsman program has been, I'm sorry, a failure for about as long as it's been around. There's my last statistics I can even find on that are 55 volunteers for over 400 facilities, 31,000 beds. So that's not a model, an oversight model we want to look to. The problem, of course, becomes anytime you start a regulation movement, then you bring in a whole nother layer of bureaucracy that may or may not be effective. But yes, the thought that we have anybody who wants to literally hang up a shingle, if I wanted to have a home health care service tomorrow and be 100% private pay, and with our demographics, you absolutely can support a business model on that. I answer to no one. And if I did something horrible, I don't even know who you'd complain to. You would have to take private legal action.
Well, I think that's the point to be made here. And I don't, we're not trying to make a value judgment here, but what we are trying to say, I think, is there are some portions of the long-term care system in Iowa that we've said is so important that we will create a structure that exists to oversee it, respond to complaints, try to improve the care that's being provided. That's on the nursing home side with the Department of Inspections and Appeals is required to go out and visit facilities on a regular basis. The Office of the Long-Term Care Ombudsman, maybe it hasn't worked as well as it should. We all want it to. I think it's getting better, which is good. Maybe it's not doing exactly what we want, but it at least is there to provide, to send the signal that this is important. But on the home care side, we just don't have that. We have no formal complaint process for all these home care providers who are doing just what you said, Joe, hang out a shingle, go out and do work. And I'm not saying they're doing it poorly. They may be doing it wonderfully, but we just don't know what's going on there. And we don't have any kind of a complaint process for a person who really feels like they just haven't been served well. Where do they go? They only have to, their only choice is to go back to the employer, the provider who they're contracted with, and say, this isn't going the way I want it to go. But that's it. Di, I know you've got a little bit of insight on this world, that there is some degree of oversight for some of the providers who do this, correct?
Well, just the certified home health agencies that DIA, Department of Inspections and Appeals, has oversight of, and they maintain a list of those entities. Somebody could go to the website probably and find out who they are. The other thing, I was going to appeal to Eugenia on this, because there's also the managed care ombudsman program for members of Medicaid through managed care, and maybe she can speak to that too. And as far as the home care type or ombudsman program, I know other states, maybe a dozen or so other states have such a program, and the level of oversight varies, by state. And maybe, I don't know, maybe this is a time, because there's such a demand for more in-home care, especially now because of even more so with the pandemic, people want to remain in their homes for as long as possible. Maybe this is a good time for us to have that conversation and assess where we are, and do we have what we need to provide adequate oversight and protections for people? And if so, would that warrant an expansion of the program, the Ombudsman's program? And I think our current long-term care ombudsman, Angela Van Pelt, is open to having those conversations based on communications that I've had with her. So, yeah.
Great point, Di. But Eugenia, you want to jump in there just to reference the managed care ombudsman program?
Yeah, thank you, everyone. Yes, you've got this system that's hugely underfunded, and it's really not made a priority for the state of Iowa. You know, we've got only 26% of our, you know, balancing incentive dollars going to home and community-based services to help support that system. You know, until we get kind of this more equal balance of home and community-based service structure support versus, you know, that in-home or the nursing home care, you know, I think we're going to see a lot of these challenges continue. I know with the Office of Long-Term Care Support Ombudsman office, they're really focused on promoting residents' rights. You know, every day, and you know, when I'm in the office, I hear the workers calling nursing homes and connecting with residents and family members to make sure that they're aware of, you know, what rights they do have, and trying to support them to create these resident councils for those nursing homes. So, and certainly they're a place to call, you know, if folks are finding that there's issues and they need help, you know, to either change their situation, improve their situation, and just be that advocate. So we're doing the best we can with the little that we've got, is what I'd say. Definitely need more funding of that structure. But, you know, chicken or the egg, you know, what do you fund first, the oversight or the workers? You know, like it's this whole structure of system that needs to be built and supported all at once.
Eugenia, thanks for that. You mentioned something that I think we need to just put an emphasis on. I don't think we've got the time to you know, have an in-depth discussion, but we should have at some other point. If I heard you right, I think you said that 26% of our dollars that are being spent, taxpayer dollars, that are being spent to provide services and supports to people in Iowa, 26% of them go to what we call home and community-based services. The kind of things we're talking about here. Home care for people with disabilities, for older Iowans. 26% of the dollar goes to home and community-based services. That would leave 74% of the dollars that are going to facilities. And while we don't have AARP on our agenda today, they're not here to speak, I do know that they've got some data that tells us, and it's been known for some time, but they've got data and lots of others, every survey that's ever been done by anybody. It says the same thing, that if you get to the point in your life because of disability, because of age, whatever, you need services and supports, you want to get them in your own home, in your own community. You don't want to have to go into and spend a significant amount of time or the rest of your life in a facility. So we've got public demand on the one hand, public wants that say, give us services in our own homes. But we've got the reverse of that on the public policy side that spends the vast majority of the dollars on the facility side. I think there's a significant public policy question there that we need to air out when the legislature comes into session. There's a significant public policy question. I think, Di, you raised it. Should we have a deeper conversation about what should we provide for people who are receiving services in the home in terms of oversight, in terms of quality control, in terms of ensuring that those people lead the best lives they possibly can and aren't being taken advantage of in any way? Should the long-term care ombudsman's office that exists solely in Iowa to assist those people in facilities, should it be expanded? How much would it cost? How would it work? What would it look like? So two, I think, important public policy questions that have just come up here. In the interest of time, Eugenia, I wanted to come back to something you said earlier about, we talked a little bit about workers, but we have a provider problem, an employer problem, that if you get outside of the large metropolitan areas in Iowa, is it fair to say that we have a significant challenge with finding providers that are even equipped to help people with these services?
Absolutely. I mean, we have funding available to help providers provide the services, and we can't even find them to apply for funding. Like, that's why the area agencies on aging, some of them are having to build the service into their program to provide that direct care, whether it's chore services or, you know, homemaker, that kind of thing. So it's a huge issue. And even them trying to hire folks, you know, trying to find the worker force as well is challenging. But you know, we have seen this huge opportunity with influx of dollars in terms of the American Recovery Act dollars. Iowa got 1.48 billion through the American Rescue Plan Act to be able to increase supports in areas. 80 million will go to increase training and support. There's going to be 84 million will go to expanding access to services. About 32 of that went directly to the area agencies on aging. So we've already got in the works, plans to, we have a return to community that's helping people transition from the hospital back to the home. We've got, again, the rapid response program that, again, provides that direct services that I talked about. Social isolation, we're addressing a lot of that with the COVID dollars, and in terms of grandpads, allowing folks to have technology in their home to be able to connect with their family members. So I didn't want to, I know we've talked about a lot of doom and gloom here, but I wanted to really kind of slip that in there, that there are some very positive things that are happening, especially with this influx of dollars that we've gotten to use over the next 4 years.
Eugenia, I think that's really important. We want to have a balanced conversation here. I think we've said that we all recognize we've got significant challenges here. But we've also got significant opportunities here to make a difference. And your reference to the American Recovery Act that has been passed, the money is available to every state to do some things to address some of these problems. So you alluded to the fact that there's an $80 million pot to do some things with. There's another $80-some million pot that will help us expand services to people, will help us do some things on the workforce side, hopefully, to encourage people to go into this field or to stay in this field. I noted that one of the things that Iowa plans to do with the American Recovery Act dollars is to give a retention bonus of sorts to over 20,000 direct support professionals who are in this field, to acknowledge the fact that they've been doing some pretty heroic work out there for the past 18 months or so, which we've called them heroes, but we haven't done a whole lot for them to acknowledge that. But now we're actually going to be doing something. And the other thing, as I understand it, is this legislation, massive piece of legislation that's bogged down in Congress, in the so-called infrastructure label, that will have additional incentives in there, particularly for home care, if I understand it correctly, that would help, again, provide incentives for people to go into this arena as providers of services or as workers, increase wages. So there are things happening here that we need to acknowledge and we need to get behind if we really care about all of this. So thanks for mentioning that. So I guess, in the few minutes we've got remaining here, we talked about the workforce challenges. We talked about lack of oversight. We've talked about lack of providers, but we've also talked about some things that are happening here. What's it going to take for us to really move the public policy needle here to allow this world of home care to be a vibrant world, to have it be where Iowans need it to be, to have access to the employees they need to have access to have those employees paid well and benefited well, and have them view this as, man, this would be a great arena to be part of because I really care about people and I want to help people. What's it going to take to get us there? I know that many of us have been fighting this battle for a long, long time, and we haven't seen a whole lot of movement of the public policy needle. But is there some hope here, and what's it going to take to get us from what we have to what we'd like to have? Joe, let's just start with you on your perspectives.
I think, and the list of possible solutions, I mean, we've touched on all of them. I don't think we're using telehealth nearly to the extent we could. I mean, there's the wage issue, but I think beginning, and maybe your audience members have tuned into that, we have no messaging. There seems to be very little coordination, if any, between all the agencies that have a stake in this. to sit down together and look at really this hard data. Where are we? So we have to count bodies first. We have to count providers and count employees and count programs. And where are we going to be? And then get that message out not only to policymakers and stakeholders so that some real plans can be made, but as importantly to our consumers, to people who think that, oh gosh, if mom and dad aren't okay next year, I think I'll just call home health care, and really do not understand that they will be on a waiting list. And I can't tell what will happen to them 5 years from now, because we have estimates of these huge, huge deficits, not 10 years from now, but 5 years from now, 18,000 short in the kind of workers that do caregiving. So I think coordination of data and messaging, I would put as priorities.
Great answer. Thanks, Joe. Di, how about you?
I guess I would echo what Joe said. Seems like forever there's been just this lack of infrastructure and to support the workforce and some of the issues that we're trying to tackle, and infrastructure as far as workforce. I mean, it's not just bridges and roads in our minds anyway, but the infrastructure to support the workforce so that we can really build a strong, stable and prepared direct care workforce. And I think the other thing that we need to do a better job of is looking at these issues in a more global or comprehensive way, rather than constantly trying to define this workforce, and I'm talking about the direct care workforce, by the population served or the settings within which they work, and look at it more comprehensively so that we can develop policies and systems like the expanded registry and some of these things that really will lift up this this workforce moving forward.
Eugenia, let's turn this over to you for about a minute, and then I'll close this session out.
Okay, thank you. And I want to keep it simple. I mean, I think just we need to increase that percentage of funding that's going to long-term care supports and services. We need, the national average is at 45%, split between home and community-based and that nursing home care. And we need to increase that 26% to more of that national average. So that will help with everything. That will help with infrastructure, supports, services, everything.
Well, as moderator of this session, I want to take the opportunity to thank the three of you for being what I knew you would be, excellent panelists. Thank the audience. And from my perspective, after listening to what you've been said, this has been somewhat of a sobering presentation. But I think the summary that I would come up with is this is really serious. Affects almost the lives of every Iowan at one point or another. And if it's really serious, we got to take this really seriously. And it's not just we on this session, it's we as legislators, we as any public policy person. It's way past time for us to do the kind of fundamental things that we need to do to give more resources to this home care arena, to improve the quality of care, improve access to care. We know what the problems are. I think we know what the solutions are. Now it's just time to get really serious about it, work with our legislators and public policy folks to get us from here to there. So let's keep this conversation going. Thanks again to the Gazette for allowing us to talk about this topic that rarely gets discussed, but hopefully will now be discussed more. So with that, I'm going to sign off and encourage everybody to have a great rest of the day. Enjoy the sessions, and afterwards, get out there and enjoy what is a pretty nice day. So thank you, everybody. Appreciate it.
Thank you, John.
Thank you.